Hello, I'm Dr. Anthony Wheeler, and I'm telling you everything that you need to know about pathology. Now, what do we have here? COPD. Do you remember what that stands for? Chronic Obstructive Pulmonary Disease, right? There's lots of symptoms associated with this condition, and it's a high-yield topic. You know some of the major symptoms, and most notably, cough, shortness of breath, respiratory symptoms, and you might even notice some edema on the lower extremities due to the heart failure that's associated with this condition. We're going to be discussing chronic obstructive pulmonary disease pathology. This is covered in your book, as I'm sure you know, because you haven't been procrastinating. You've been reading the lecture material and you've been watching the lectures. That's why I'm proud of you. If you have some friends or you're procrastinating a bit, there's still time to reach your full potential. Don't wait, because time's ticking. So what's COPD? Well, we have to remember that airflow obstruction from the lungs is its main pathology, right? It's an obstructive disorder. It's in the name. Airflow obstruction from the lungs is a symptom of COPD. Chronic obstructive pulmonary disease is a chronic inflammatory lung disease. A triad of disorders are associated with COPD, which include asthma, emphysema, and chronic bronchitis. Chronic obstructive pulmonary disease is characterized by airway obstruction. And in COPD, the air gets trapped when the person is trying to exhale. In this condition, known as COPD, the volume of air that can be forcefully expired is decreased, especially during the first second of expiration. This results in a decreased FEV1 to FVC ratio. I believe it's less than 70%, but don't quote me on that, because I am not a pulmonologist. I'm a pathologist, and that's why I'm telling you everything about pathology. Now, the total lung capacity refers to the amount of air in the lungs during maximum inflation. And the total lung capacity is usually increased in COPD due to this air trapping. And that is reiterated here. So keep in mind that due to air trapping, the total lung capacity in patients with COPD, the total lung capacity often rises. And you're going to rise because you've been getting through high-yield lectures like this one. You've been doing the reading. You're so smart. I'm proud of you. Going to give you some claps. Keep up the good work, and I'll see you next time. Till then, take care.